And when it comes to funding healthcare, once again the Coalition fails to understand Braddon and Tasmania. Braddon has some of the worst health indicators in the nation. Combined with an ageing population and a disproportionate amount of people receiving a Commonwealth benefit, it becomes clearer why people in Braddon are worried about the cost of health. My electorate has a high degree of chronic disease and poor health outcomes, higher preventable hospitalisations, higher all-cause cancer and all-cause mortality rates compared to the state average. But the ability for people in my electorate to pay more for health care is of concern, and any pressure they face to pay more will only add to poor health indicators for my community. The national average per electorate of people receiving the age pension is 16.36%. In Tasmania, that average is 18.81% of the 5 electorates. In my electorate, the percentage receiving the age pension is 20.67%. The national average per electorate of people in receipt of a healthcare card per electorate is 7.98%. In Tasmania, that figure is 10.29%, and in my electorate of Braddon, the figure is just below that at 10.08%. The adjoining electorate of Lyons has 10.55%, and the electorate of Bass the figure of 11.89%. So it's little wonder that across all 3 electorates, that a universal healthcare system that does not hit the back pockets of people in our communities is a really high priority. And a message that the self-styled 3 amigos failed completely to understand. And if the Coalition wanted to look further to understand why health is so important to Tasmanians and the people of Braddon, then perhaps they could look at the figures provided by the ABS relating to the number and receipt of a pensioner concession card. These people are not wealthy by any means. Their circumstances as such rely on the Commonwealth support just to get by. The national average is 26.59% of each electorate that receives a pension concession card. The Tasmanian average is 33.7%, and in Braddon the figure is 38.19%. So given the low wage, poor health outcomes and reliance on Commonwealth support, you would think the Coalition would respond in a positive way, but no. The Tasmanian community shook their heads in amazement when it was revealed from figures obtained for the Parliamentary Budget Office that Tasmanian hospitals will suffer a $1.151 billion cut over the next 10 years. In my electorate of Braddon, with the health challenges our community faces, the cut is $153 million over that term. Our local hospitals just can't afford it. Then there's a cruel attack on Medicare, with the GP tax being extended for another 2 years. The Coalition wrongly labelled the campaign Mediscare. But it was not Labor's campaign that scared the community. When you're living on a low income, struggling to put food on the table with a sick member of your family and facing increased costs to see the doctor, you're very scared. Making the sickest and poorest pay more to see a doctor is not fair. And I am proud to have been part of a Labor campaign that put healthcare as a paper issue for the community.